Arriving in a new country can have many challenges. As we become familiar with the new system, we find information and learn new ways of overcoming these challenges. Living with a chronic illness like HIV is complex. Access to treatment isn't always straightforward. As newcomers, there are many competing priorities and challenges when settling down in a new country. But access to HIV treatment, support, and care is crucial for your health as well as the well-being of your family and community. As a newcomer, HIV treatment access in Canada is a challenge that we can overcome. This video will provide information to help you understand the Canadian health system better and to make informed choices.
I think I've eliminated that fear of having to live with it because I know it's okay. I know there's help out there for me that can make me well, that I feel like I can live a normal life. I have come a long way. During my journey, I learned the importance of advocating for my own treatment. This is very important in Canada. You have to help yourself. I hope the information will help newcomers living with HIV in Canada.
Do you know that an estimated 65,000 Canadians are living with HIV? Just over 1 in 5 people living with HIV in Canada are unaware that they have it.
Canada has a universal public health insurance system for medical and hospital care called Medicare. Canada also has 18 different public drug plans, of which 13 are provincial and territorial, and 5 are federal. Each of the plans is different in terms of its scope of coverage. Public drug plans vary across Canada, with some covering patients based on age, some based on income, and some based on specific medical needs such as HIV. An estimated 42% of people residing in Canada, including the vast majority of people living with HIV, rely on public drug programs to access essential medicines.
Newcomers enter Canada through 2 major routes to become a resident of Canada. The first one is by applying as an immigrant, or the second one is by filing a refugee claim. So there are various categories of immigrants and refugees. Immigration status, which is commonly referred to as simply a status, it refers to how one is legally in Canada. Status is extremely important for newcomers because it determines which services they have access to, and it impacts their rights in Canada. The government of Canada, the federal government, provides health care to refugees through a health care program called Interim Federal Health Program, or IFHP. Refugee claimants are eligible for this program once the Immigration, Refugee and Citizenship Canada confirms that they are eligible to make a refugee claim. As of April 1st, 2016, you do not have to renew your coverage. IRCC will automatically extend your coverage. After you have been found to be eligible to make a refugee claim, you will receive a document with your picture on it called the Refugee Protection Claimant Document. This document is a proof that you are eligible for the Interim Federal Health Program. Once your refugee claim is successful, then you can apply for permanent residence, and you can then apply for health coverage under the provincial or territorial health insurance plan.
Remember, when you go to your family doctor, you must always walk with your interim federal health plan document. It is very important. Now, finding an HIV doctor can be very challenging, especially if you live in rural areas. But remember, your local AIDS service organizations is a good place to start. They will help you put together a healthcare team that will be instrumental in assisting you with your HIV treatment.
If you are in Canada as a temporary resident, you may have access to provincial health care. But this depends on the kind of temporary resident status that you have. Visitors to Canada are not eligible for health care in any of the provinces. A visitor to Canada will need to pay for health services and medications through private insurance or out of pocket. With respect to students, health care coverage for individuals in Canada on study permits varies from province to province. You can contact your school's international student office to confirm what kind of health services you are eligible in the province where you are studying. With respect to workers, again, healthcare coverage for individuals in Canada on work permits also varies from province to province. Again, you can discuss this with your employer to confirm what health services you are eligible for in the province you are working and residing.
All temporary residents to Canada, that includes students, workers, and the visitors, are allowed to bring in a 90-day supply of medications when they enter Canada. They can also have one additional 90-day supply shipped to them during their stay in Canada. These medications must be in their original packaging with an official prescription and an official English or French translation if necessary. In the case of medications that are shipped to Canada, you should include proof of your temporary resident status, for example, a copy of your visitor visa, and passport pages showing your date of entry or a copy of your work or study permit. If you are a Canadian citizen or permanent resident, you may apply for government-funded health insurance.
Finding drug coverage information. All provincial and territorial public drug plan formularies provide coverage for certain HIV medications. Each province and territory in Canada has a different program for subsidizing drug costs for their residents. The provincial and territorial governments have created drug formularies which list certain drugs and treatments they're willing to subsidize. The availability of certain drugs in each program varies from province to province and from provinces and territories. These programs have different criteria for who is eligible for coverage, which medications they will pay for, how much the province or territory will pay, how much copayment you may have to pay if required, and which drugs are listed in which province. Check with your local healthcare provider or your local aid service organization to learn about whether you are eligible for coverage. The Treatment Map is a comprehensive online tool to empower people living with HIV and hepatitis C to interactively access information on medications available in the provinces and territories. It is intended to help you find information about drug coverage and benefit programs offered by the federal, provincial, and territorial governments. For each, you will find an overview of the drug programs, eligibility criteria and costs, as well as links to more comprehensive information published by the relevant health authority.
Community health centers, CHCs, in Canada offer primary care through a team approach. You must make an appointment in order to receive services. All CHCs charge low fees and require that you live within the area in which the services are provided. An application form has to be completed when you access services. The information and your visit will be kept strictly confidential.
Health Canada's Special Access Program provides access to medications and your doctor can apply for it on your behalf. But you must discuss with your doctor since there may be costs involved. Pharmaceutical companies often have clinical trials of their drugs that give eligible participants access to drugs that are not yet approved or widely available. Some pharmaceutical companies may also offer compassionate care programs. You should discuss your options with your doctor.
In 2015, I came here to Canada as a refugee with my family. First, I went to the Immigrant Settlement Agency in St. John, My wife and my daughter, who's 8 years old, are HIV positive. I found it very difficult to get help when I went there, so I moved to Ottawa, to a shelter. Living in a shelter is very difficult. You have one room, me, my wife, and 2 children, and you cannot speak about your HIV status in there because there's no privacy. So eventually what I did, I sought help from the local AIDS service organization.
Please get in touch with your local ASO to find out about other resources that may be available to you to access medications. For Canadian citizens or permanent residents, each province and territory has their own health insurance plan, which may have a 3-month wait period before coverage can begin.
I was so scared. I didn't want to go to an AIDS service organization. I didn't want to meet up with other community members. What if other community people saw me and my family? So the support worker met with us in privacy, like 2 people just meeting for a coffee, and we talked. And I was able to express my concern for me and my family.
You have medication for HIV, but no medication for stigma. Educating ourselves about HIV is the only way out of stigma.
If you are moving from one province or territory to another, or from a federal to a provincial or territorial coverage, you must check the rules for coverage in the new location, as these may be quite different. The drugs that you take may be not covered in the new location, or there may be different financial arrangements or coverage. There may be other restrictions you will also need to be made aware of. It may take several months to meet the residency requirements for coverage in the new location. So it is a good idea to make sure you have enough medication to last you at least 3 months, to make sure you don't run out before you're able to access the services in the new area. Check to see whether your former location will provide any coverage or additional medication after your move until you're covered in the new area. Also, contact the AIDS service organization in your new area as soon as you arrive. If it's possible and affordable, consider purchasing private health insurance. This is called Visitors to Canada for the initial 3 months. Also remember that not all health-related expenses are covered by private insurance.
If you or a family member have a medical emergency, please remember you can always get help at any hospital emergency room, regardless of your immigration status. Please note, however, you will be charged a fee for services.